morning, everyone. We'll call the special meeting to order. Let's stand for the Pledge of Allegiance and a moment of silence. Pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Supervisor Hall, could you sign in, please? Roll call, sure we have 2 supervisors absent. I'd look for a motion to approve the agenda. Motion to approve. Second? Motion and a second by Supervisor Sweefeloff, second by Supervisor Hartman. All those in favor signify by saying aye. Aye. Opposed? All right, no members of the public wishing to be heard. Business items.
Resolution number 14-20, resolution to provide county administrator and county board chair emergency administrative flexibility to address COVID-19. Now therefore be it resolved that the Chippewa County Board of Supervisors does hereby acknowledge, accept, support, and authorize the county administrator and county board chair to implement necessary plans to ensure the safety and health of the Chippewa County staff, county board supervisors, and other county elected officials, residents, and those traveling throughout Chippewa County. And be it further resolved that the county administrator and county board chair are authorized to take all steps necessary to ensure the safety of Chippewa County staff, county board supervisors, and other county elected officials, residents, and those traveling throughout Chippewa County, and may implement procedures that violate county ordinances, policies, work rules, and any other administrative rules if they believe those violations are necessary to ensure the safety and well-being of Chippewa County staff, county board supervisors, and other county elected officials, residents, and those traveling throughout Chippewa County. Be it further resolved that this emergency authority of the county administrator and county board chair shall remain in effect until rescinded by formal action of the county board, presented to the county board on March 16th, 2020 by the Chippewa County Board Chair.
All right, we need a motion and a 2/3 vote to suspend the rules so we can actually talk about this resolution.
Motion to approve.
Second?
Second.
All right, motion by Supervisor Thornton, second by Supervisor Sweefeloff. So now we need to vote on that, and that'll be 2/3. Yes. Release? 13 yes, 0 no. All right, now do you want a motion first, or?
Yeah, get on the floor. Yep.
Now we need okay, second? Okay, motion by Supervisor Sweefeloff, second by Supervisor Ewer.
Well, thank you. First of all, thanks for everybody coming. Obviously, we are in some surreal times, things that nobody's dealt with before, so I really appreciate the cooperation from the board. Just to give a little background in the last probably 4 or 5 days, this has pretty much consumed every organization across the state, across the nation, across the world. So I want to thank Angie, just starting out with in her department. They have worked unbelievable hours. We've been in constant contact. They've done a great job. Everybody I've dealt with throughout this process has been so cooperative, has done a great job. Sheriff's Department, judges, there's a lot of things. This touches so many things you can't even imagine how much it touches. So first of all, I'd just like to thank everybody for that. And then basically what I want to say is that we're using the latest information we have available to us to try and come up with the best plans, not only the current plans, but future plans, because this thing's moving so quickly. You know, it's not just about what's happening today, this hour, this minute. It's about what's going to happen. So we've been trying to anticipate that and obviously meet and have contingencies for whatever the next steps are. I feel extremely confident in what public health is doing and how their emergency management and how they deal with that. My concern right from the beginning is how is the county proper going to deal with this? How are we going to deal with our employees? How are we going to, work with all our partners that we have in the county with balancing safety, obviously is number one, but we also provide a service to the citizens of the county, and how can we best do that to make sure our employees are safe and that they continue doing those services, but also being safe for their health. So this is what we put together. I don't know if anybody needs additional time to read it. The letter, the explanation, the resolution itself, and the email all go together. And this is the best information we have. It may change by the time I walk out this door, and I'm not exaggerating. We have had meetings that we thought we were going to move forward in a plan, and before the meeting was over, we've already got different direction. Angie is here. She's going to come up and just give you some, up-to-date information so you guys have the proper information. We're using CDC and public health. That's really what we're going off of. So Angie, if you could just come up and just give some.
Good morning. So one thing Randy talked about was just that this is a pandemic level. So the World Health Organization is calling this a world pandemic. The U.S. government has declared a national state of emergency. The state of Wisconsin has declared a state of emergency. And this morning we are going to ask Lee to sign for a local declaration of local emergency. Pandemic means everybody should be concerned. In the world of public health, we prepare for things like this. This is like the Super Bowl of public health. We have plans in place, and we practice those plans on a regular basis. So this is not just like new to us. We're not dusting off the shelf with the plan. These are plans that we use and practice on a regular basis, and I'm thankful for that. Last week, internally, I opened the incident command structure or system in my department and had all our public health nurses and a few additional people just responding to try to mitigate the risk. We are in the phase of mitigation, so I am glad to report that Chippewa County currently has 0 positive cases of COVID-19, and we'd like to keep it that way. If we do a really good job and we can mitigate, we can stop the spread. So a lot of people are like, whoa, are people taking this too far? Everything's being canceled. The reason things are being canceled is to mitigate the risk. So if we can keep people not around lots of people, not at large events, it's going to make that a lot easier. On Friday, the CDC's recommendation was that there shouldn't be gatherings of more than 250 people. The current recommendation, and that changed on Sunday, is 50 people or less. They're talking about weddings, work, all kinds of situations. I mean, count the people in this room, we're probably close to 50. So we are working with agencies, businesses, long-term care facilities, schools. Every community partner you can imagine has reached out in the last week. We do have a virtual EOC or a center set up with resources that are specific to different types of industry. So it's resources for school districts, resources for law enforcement, resources for emergency management. Originally, when this broke, the process that the state and CDC used is that people had to call the local health director. The local health director had to work with the state of Wisconsin to get approval for testing. So I was getting lots of phone calls at 2 in the morning, 4 in the morning, anytime somebody went to the ER, urgent care, and wanted to get tested. They changed that so that now medical providers can order the testing. So now I don't get the phone calls at every hour of the day. I still get other phone calls, but not from the medical world as much. And they're learning the process and their systems that they can use. Just so that you all know, I do have backup plans for if more testing supplies become available and we would get to a portion in Chippewa County where we would need to set up mass screening or triage. We do have 3 locations throughout the county that have agreed to work with us. That's Northern Wisconsin State Fair, Bloomer Baptist Church, and also the Cornell School District. That would be a last resort. I don't really want to bring a lot of people into a school that are potentially infected with the virus, so that would be a worst case scenario. I talked to my mom and my grandma this weekend and said, have you guys ever been quarantined before? And I never have. I've never had school shut down, first for my son. My mom said not in her lifetime. My grandma said yes because of polio. She had to stay in her yard for an entire summer because of polio and a lack of vaccine. So I'm only bringing that up because currently there isn't a vaccine for COVID-19, but there's lots of researchers working on that currently. Things change really fast, as Randy said, from day to day, from minute to minute. There's times I say something and then I look at Nikki, my PIO for communications. Is that right? Did that change? Because even as it comes out of my mouth, I feel like it might have changed. So I get hesitant, to say too much because it really does change very quickly. The guidance that we get changes fast. And sometimes we ask the state, we work really heavily with the state, Wisconsin Department of Health Services and the CDC, and their information changes fast as well. And there's times where we ask questions and they say, we don't know. So sometimes we're going back to community partners that are asking questions and saying, we don't know that yet, we'll figure that out. Last week, we did pretty well internally using our incident command structure. With incident command, you can make things wider as things get more concerning, and you can make things narrower as they're less concerning. Last week, we had just 2 positions. I was the incident commander and Nikki was my PIO managing communications. By the end of last week, especially Thursday was a big day because so many sports teams and things like that canceled everything. The governor declared the emergency, the schools, universities decided to go online, and then Friday with schools canceling. That really changed the public perception about a lot of things, and that's when we realized that we needed to open the incident command structure or system countywide. So this morning I had a meeting with community partners. First I did with my incident command team at 8 a.m. Then 9 a.m. we met with community partners, now board, and then we'll meet with department heads after this today. Just so that you guys know who are in my key roles for incident command structure, I have the privilege of being the incident commander. Jim Kaler is my safety person, and he has a team working with him. Kristen Kelm is my liaison. That means she works with all the community partners, people who want to know, what should I be asking if my people are serving Meals on Wheels? Kristen would follow up on a question like that. Anything with community partners. Nikki Putivals is my PIO or Public Information Officer. Last week she was creating all the messaging. This week she will have other people creating messaging, and she will be overseeing all communications that happen via Facebook, website, press release. And so Nikki has a big job ahead of her. Jenny Lenbaum in my department, and she has had massive training in emergency response preparedness, is going to be my operations section chief. I'm going to have 2 lines open for intake. We had 1 line open last week and it got unmanageable by Friday, so we'll have 2 nurses on call. I've been doing the evening and weekend on call. I will share the fun with people in my department as this goes on, just because there's so many calls coming in that it really does exhaust a person. So we will rotate who is on call. Rachel Potashik will be my planning section chief, and she will work with different individuals from throughout the county to work on what if this gets worse, so that we're prepared if it does get worse. Dennis Brown will be the head of logistics, and then Sarah McQuillan will be finance and administration. And each of those people have teams that they're creating right now to work with them. So I just kind of wanted to give kind of the overview of the system and who is doing what. Wanted to also just say that the community partners that we met with this morning, we will continue to have 2 check-ins per week with all community partners. We do have a way for them to call in or log in through the computer, because we want to practice what we preach, which is not having larger than 50 people at a meeting, and there's way more than 50 people invited to that meeting. Those meetings will happen on Mondays and Thursdays from 9 to 10 a.m. And the other thing that I really wanted to make sure to say is I just can't believe the community response and the kind and compassionate community that we are a part of. I have had so many people reach out to me in the last 2 weeks and say, how can I help? Put my name on a list, tell me what you need me to do. I've got a strength here. Times like this, they're challenging to work through, but it also really does give you a sense of community, a sense of humanity. So I've been very appreciative of that, and very appreciative to our Department of Administration. I've been working very closely with Randy, Tracy, Tony, Todd, Jim, Melissa, and Andy. And anything that I have said I need for my department to follow up and mitigate this has been done. It's been done fast, it's been done efficient, and it's been done with kindness. So I am extremely grateful for that, so that we can do what we need to do to stop this from spreading. We have had a number of potential cases. We have had to do some isolation and quarantine measures. I do want to just explain really briefly what that means. You isolate people who are sick so that they don't get other people sick. You quarantine people who are well so that they stay well. So sometimes the media doesn't use those terms appropriately. I just wanted to kind of help people understand what that means. Currently, because we don't have any positive cases, we are doing verbal orders with people. If we get any sense that they're not going to follow those verbal orders, we would do a written health order. Law enforcement occasionally has to get involved with quarantine if people don't follow quarantine. Just so you all know too, we do isolation and quarantine other times, not just related to pandemics. So if it's a case that relates to TB. So again, these are not things that just came about because of COVID-19, and coronavirus isn't new. Coronavirus has been around. This is just a new strand of the virus. It's going to take some time, for people to learn. Whenever there's a new virus, it takes time to learn about that virus. How long does it take to die? What temperature does it need to die? Things like that. So the CDC and researchers are definitely working on those pieces of the puzzle, and we in the health department are really focused just on making sure that we're mitigating, supporting community partners, answering phone calls that the public has, making sure that people who have been exposed, and we have people in our county who have been exposed to positive people, making sure that those people are not going to work and that they are staying home. The part that gets challenging with that is there are employers who really do mandate that people come to work. I had a construction guy that I talked to that said, my boss is not going to let me be off. And I said, I would like to talk to your boss, because he's not going to be down one man, he's going to be down an entire crew if you were exposed to somebody who's positive and you're positive. It's extremely contagious. And we can't mitigate it if people are demanding people show up to work. So part of the reason that I'm here is just to support this going forward, because we can best mitigate things when we use common sense and when we don't demand people show up when they're ill or when their kids are ill or when they're showing symptoms. The main things to look out for are a fever, shortness of breath, and a persistent cough. So anybody who is having those symptoms, I would definitely consult with the health department or your primary care physician. For the sake of protecting our medical community and our emergency management teams, if people think that there might be something going on, we encourage them to call the ER, the urgent care, or their primary provider before they get there. We put out tons of recommendations to the health community. Some people were following those recommendations, some people weren't, and we found out because we asked patients that were calling, what did the people look like when they swabbed you? Some people said they looked like Ghostbusters. Other people said they just had a surgical mask. Well, a surgical mask is not going to protect you from COVID-19. So we knew we had work to do with those healthcare systems to make sure that their staff were up to code. If they were not, I would have to isolate every worker that came into contact with a positive person. That can wipe out your medical community really quickly. And there are other communities that are seeing that happen. If you watch the media, which I don't encourage you to watch the media 24/7, we want to be prepared. We don't want to panic. In states of emergency, you have people that over-prepare or over-panic. You have people that under-prepare, under-panic, and you have people that are right here. We're trying to live right here. We're prepared, but we're not panicking. We're trying to keep people calm, safe, and ready if it gets worse. Any questions?
They said this will maybe slow down more when the summer comes. Why is it flourishing down in Florida where it's warm?
So that's a good question. There are people that are kind of what's considered like a primary case, or people who've traveled to a high area. Then there's also something called community spread. So community spread is where you have a case and it isn't somebody who traveled, but they came into contact with somebody else who's affected. So the community spread is happening in lots of parts of the United States right now, including Wisconsin. So the state of Wisconsin Department of Health Services is not declaring that we have community spread, but they are saying that we have cases out there where people have not traveled. Any case that's happening where people haven't traveled is considered community spread. So those are places where they maybe didn't close things down quick enough, and they weren't able to mitigate the risk. So people were out and about, people were interacting. We've gotten some very concerning phone calls of things that I'm like, if this comes back positive, I'm not going to have a life. Because of the number of contacts, and contacts with vulnerable people is what we're looking at first and foremost. So if somebody has a chronic health condition, the elderly, people who have lung conditions, anyone who has COPD, asthma, is kind of chronic pneumonia type cases, anyone who has a lung condition especially is at higher risk. And then the aging population. So we put a lot of information out to faith-based organizations on Friday, just recommending that they either cancel or limit interactions because the aging population is really at risk. Leslie's been great at communicating with me and kind of just saying, hey, what's your opinion? This is what I'm seeing. What are you seeing and hearing, to try to protect that population?
How often do you communicate with the health providers, like Mayo,
Yep.
Marshfield? Because I know things are rapidly changing, and the parameters that I've been given are more stringent than what you just.
Sure, and things definitely are rapidly changing. We communicate with the health systems on a daily basis. So Kristen Kelm, our liaison person, she's not here, I'm pointing to her because she's by phone. She is the one that does the communication with the hospital and health systems, and then we do direct people to that online EOC that has lots of resources for the medical profession, and then we also are putting things on Facebook and our webpage. It was under public health, but we are putting it under the county-wide webpage today.
I understand this is rapidly changing, because I believe there's going to be test sites as soon as tomorrow.
Yep. And some places do have drive-through testing already. So Mayo Rochester has it set up where they have the provider in proper PPE or protective equipment, and they're just mass swabbing. It's just like a drive-through, like you're going to get food, only you don't get food. Yeah.
What, if you do quarantine people, who is to take care of them, I guess?
Yeah, that's a great question. That was a question I asked early on too, and it really depends on the state that the person's in. So if we have somebody there's people that are on ventilators and intubated, they're sedated, they're not conscious as they're going through this process. Those are the people that are the most at risk, the vulnerable populations. And if you did watch the news when everything was happening in China, they quickly ran out of enough ventilators and enough supplies to manage the pandemic, which is why it's so important that we're doing this now, because we don't want to get to the level that we need 50 ventilators in Chippewa County. We don't have 50 ventilators in Chippewa County. So we want to keep it mitigated and not see it spread, because it's going to save us time and money and energy and lives in the long run. Can you tell me what your original question was? Because I feel like I went down a rabbit hole. Sorry.
If you quarantine somebody at their home,
Yeah.
they have it,
Yep. Who's going to care for them? Correct. Yep. So a lot of people we do assess that with people. Do you have somebody that can drop off groceries, that can do things like that? So far, everyone has had caring family members, friends, neighbors that are willing to do that. If we got into a situation where that wasn't possible, we would probably reach out to organizations like United Way that have 800 volunteers on a volunteer list to see who might be able to help with that. So far, though, people have been able to manage. But there's definitely different levels of care need. So we do want people as alone as they can be, especially if somebody is positive. Thankfully, we haven't had anybody positive, but we have asked a number of people to limit their interactions with people and to really socially isolate. People have been very amendable to that. They understand that it's a concern. They care about people. They care about their family. They care about their coworkers. That's one thing that gets a little bit tricky, and we have put out a lot of messaging around anti-stigma. There's a lot of stigma that happens. Even some of our school districts have been impacted with that. And we've heard some pretty horrific stories of that happening, and so we do really educate and talk to people about how to reduce the stigma related to the COVID-19.
Provider in our area that does in-home supports call and say if there are some folks that need some assistance of some kind. So some of our providers are reaching out. I do plan to reach out to a few more in case we are in that situation, pass that information along.
And I've reached out to lots of people in the county to say, could you help with XYZ just to take some things off of my staff right now so that they can focus on this?
Do you feel that we should suspend our committee meetings?
I knew somebody was going to ask that question too.
Unless it's an emergency, but this morning they also said on the news that you should just stick together with your inner group of people. Even 50 was too high a number.
I'm on the bubble. I'm so on the bubble with it that I'm hesitant to say. I don't think it would be a bad idea for 2 months and to reassess at that point.
Are you interested in Mayo's doing it?
Yeah,
No more than 10?
no more than 10 at Mayo. I had not heard that yet. Thank you for sharing that.
I was advised not to come here for that.
I know a lot of people are using call-in features, using virtual meetings, and we are definitely encouraging that as many meetings as we can have that way. I know some places have just canceled meetings altogether if they don't have the capacity to do call-in and virtual meetings. Thank you.
Yeah, that's how fast things changed. Obviously, I worked with Angie this weekend, and we did talk about that, and she was still on the bubble, but as things change, that's why I think we need this flexibility to be able to do that, and if we have to cancel, we have to cancel and move forward. Okay.
Friday, you were part of that. We did that on our cell phones, that meeting.
Yeah.
It really worked well. I mean, you have to slow down and speak, but I mean, have you talked about doing any of our meetings that way?
Yep, we've talked about it, yep. Okay.
You're gonna change the work rules, that's for all departments, sheriff's department, this ordinance applies to every county governmental entity that we have?
Correct. If we have to. I mean, we're not changing them to change them, but if it'd be related to this issue, not just in general.
Ready to vote? Let's vote.
Wait.
Sorry.
Small typo. Talk about going to different counties, and you mentioned the different countries. Should be country instead of county.
Yeah, we'll change it.
I mean, it's just small.
Yeah, that's fine. We saw it. And I guess just the last thing I'd like to say is that, there's going to be a lot of decisions made really quickly. We're going to use the best information available at the time, but there's going to be a lot of Monday morning quarterbacking too. So you're going to hear a lot of stuff. Again, we're trying to do two things: keep our employees, the public safe, and try to keep operations going. So that's the basis for all the decisions.
Let's vote. Release? 13 yes, 0 no. Any communication? Future agenda items? Motion to adjourn. We're adjourned.
Jared, you can't pick them up. You can't pick